Well, I think there's been three things that are worth mentioning that have come out in the literature at meetings this year. One involves the use of insulin in feline diabetes. One involves the use of compounded trilostane in the treatment of Cushing's disease in dogs. And the third involves the use of the Hill's diet YD in the nutritional management of hyperthyroidism in cats. So let's start with diabetes. For many years, many of us have been advocating the use of basal insulins like glargine insulin in the treatment of feline diabetes. And the primary reason was some really good data that was coming out of Australia showing that they were attaining very high remission rates using basal insulins in combination with high protein, low carbohydrate diet. What recently came out was a paper from the same Australian group, Jackie Rand and her colleagues, that did a prospective study evaluating 3 different insulins in newly diagnosed feline diabetics. They looked at basal insulin, glargine, they looked at PZI insulin, and they looked at lenti insulin products. And they took 24 diabetic cats, randomized them into 3 groups, and then stabilized them all on the same diet. So all 24 cats were placed on the same high protein, low carbohydrate diet. 3 groups of 8 cats then were assigned to either glargine, PZI, or lenti. And the interesting thing was the results seen with remission. In the glargine group, 100% of the cats went into diabetic remission, versus about 25% in the lenti group and about 38% in the PZI group. So this was really the first prospective study that was a head-to-head, one insulin versus another, that again demonstrates the efficacy of basal insulins. And we think that the basal insulin has something to do with combating glucose intolerance in the diabetic cat. So by getting rid of glucose intolerance, by getting rid of beta cell toxicity, and by switching these cats to high protein, low carb, you can really get a very high remission rate in diabetes in cats, and that's everybody's goal. So what glargine insulin does is it really takes diabetes and takes it out of the realm of a chronic disease and puts it into something that we can actually attain remission in. So I would think the recommendations would still be that in newly diagnosed diabetic cats, the best thing we can do for them is put them on glargine insulin, switch them to high protein, low carb, and you're likely to see a very high remission rate within about 8 weeks in your feline patients. The second update has to do with the use of compounded trilostane, which is an adrenal enzyme inhibitor that we use to treat Cushing's disease in dogs. Now, many of us used the compounded product before Veteril, which is a DECRA product, became available. And we were having reasonably good success using the compounded product. But this nice study that recently came out from Audrey Cook at Texas A&M showed that there's a great deal of variation in compounded trilostane products from one company to another when compared to the DECRA or Veteril product. So what they did in this study is they basically assayed the content and the stability of trilostane from the approved product versus 4 or 5 compounded products. And in the compounded products, they saw a great deal of variability, both in the concentration and availability of trilostane across products. For instance, there was anywhere from 48% to 150% of the product in the compounded preparations. What this means for you and I in treating patients is that we can get a great deal of variation in clinical response that doesn't have anything to do with the lack of efficacy of the trilostane, but has more to do with the variability associated with the compounded product. So my recommendation is that when at all possible, we should always try and use the approved product due to very assured concentrations of the product and bioavailability of the final ingredient. And then the third thing that we've been working on in the last year, since the advent of the launch of Hill's Feline YD, has been the use of YD, which is an iodine-restricted food, in the management of feline hyperthyroidism. In our practice, we use all modalities. We use radioactive iodine, we use antithyroid treatment, medications such as Tapazole, either orally or topically. We don't do very much surgery in our practice. What YD offered was the potential that you could reverse hyperthyroidism both biochemically and clinically by feeding cats an iodine-restricted diet. And the premise is very simple. You need iodine to make thyroid hormone. Therefore, if you restrict the amount of dietary iodine available to these cats, we can take an elevated thyroid level and bring it back down into the normal range. And that was a theory that was put out by Dr. Nachreiner over a decade ago. What Hill's has been able to do is to successfully manufacture a product, both dry and canned, that is iodine restricted, somewhere on the level of about 0.3 parts per million of dietary iodine. And when fed to hyperthyroid cats, you'll see a decrease in the circulating total T4 concentrations down into the reference range, for our laboratory down below 4.0, and in most of our cats down below 2.5 micrograms per deciliter. What this allows for is, through the use of food alone, normalization of thyroid function without having to add in antithyroid medication. Now, a lot of questions have come up about the diet. One is, well, what's the long-term efficacy? We're evaluating that in our practice, where we have cats now coming up on 1 year of being on the food, but Hills has data on hyperthyroid cats being treated with the diet for close to 5 years. And what we see is that as long as the cats continue to eat the food, and most importantly, don't have access to other foods, we can control both the clinical and biochemical signs of hyperthyroidism. The other thing has to do with, well, what are the complications or ramifications, if any, of feeding an iodine-restricted diet to normal cats? All of us deal and practice with the multi-cat household. So how do we deal with the healthy cats in the house when we're wanting to feed an iodine-restricted diet to one hyperthyroid cat? Well, again, the data shows that feeding a restricted iodine diet to normal non-hyperthyroid cats for up to 1 year results in no physical, biochemical, or endocrinologic abnormality. Now, it is important to remember that this is an iodine-restricted diet. It's not an iodine-deficient diet. In the work done by Karen Wiedekind, what we found, or what she found, was that dietary iodine levels below 0.17 parts per million would result in iodine deficiency. Hill's YD is at 0.3 parts per million, which is well above the level that would be considered deficient. So in our practice in a multi-cat household, if the other cats are healthy, we recommend just transferring all of the cats from their current food to feline YD. And I think what you'll see with that is it will be a very important tool in the management of hyperthyroidism in cats. It's not a cure for hyperthyroidism. We don't know the underlying cause, but it is another tool in our ability to treat them. So now we have diet, antithyroid drugs, surgery, and of course the gold standard, radioactive iodine.